So this is more important for us. And stroke is the first disease, whether it is a brain stroke, heart stroke, whatever it is, we need to prevent that rather than after getting it, taking treatment. Okay. So, like man could heart attack cause that. So this is called as a brain attack. This stroke is called as a brain attack. When does it happen? So it happens when the blood supply to a particular part of the brain is severely reduced. So brain, we have two hemispheres with a small brain. So major right and left hemisphere, and with a small brain which we call cerebellum. So each of these part of the brain will have circulations, and circulation is by major vessels. We call them carotid arteries. So these carotid arteries, they are major, come from the heart to the neck into the brain. So my boss used to tell me that you have to consider these vessels like our taps. So in a house, మనం ఇల్లు కట్టుకున్నప్పుడు plumbing first ఎంత important, తర్వాత వాటి maintenance ఎంత important. Our vessels are similarly like taps. Taps means the pipes, like pipelines. So these vessels are equivalent to the pipelines. So when these pipelines get reduced blood supply within them, so it immediately gets circulation cuts down to the brain. So brain, when the circulation comes down, it suffers injury. So oxygenation to that part of the brain comes down. So when that comes down, it gets damaged. So as the brain is very important organ, so it is the main thing which will give a signal to do a work. If I want to talk now, the first signal should be from the brain. So a hand, when you try to write, when you want to hold an object, so the signal comes from the brain. So if that part of the brain is damaged, then immediately it gets paralyzed. So it results in the impairment of the brain function. So this is called as cerebrovascular insult or cerebrovascular accident. So in medical terms, we call it as cerebrovascular accident. In normal terms, we call it as a stroke or a brain attack. So how much is it prevalent in India? It is estimated that in rural areas, it is around 84 to 262 persons per 1 lakh population. In urban, it is much more, 334 to 424 persons per 1 lakh population. So before going to types of stroke, so with this prevalence, we need to know why. In a few next slides, I will show you why it is caused, how it is caused, and all. It is very important to prevent stroke. In a heart stroke, and a Gundapot either patient will have medical management or stents and patient gets improved. Okay, but in brain stroke, what happens is patients get paralyzed, or paralyzed in form of either hand or leg may get paralyzed, speech may get paralyzed, balance may be paralyzed. So all these are important for our day-to-day life activities. So once we get any of these symptoms, he is bound to be bedridden if it is a major stroke. So it not only affects the person, it also affects the family. So that is why a brain stroke is much more important than a heart stroke. I don't say that heart stroke is not important. Heart stroke, if it is severe, patient dies. If it is recoverable, patient improves. You will not have any deficits. But in a minor stroke also, even in a minor brain stroke also, it may take 1 or 2 months for his complete recovery. So brain stroke, we should be much more serious. So as I have already told, stroke is because of reduced blood supply to the brain. So when blood supply gets reduced, then it is called ischemic stroke. Sometimes the BP suddenly rises up and causes the blood vessel to burst. See, if this is blocked, then the supply to the brain will come down. That is called as ischemic stroke. But sometimes the vessel may get ruptured. So that is called as hemorrhagic stroke. These are the two types of major strokes. There are so many other strokes. There is cardiovascular stroke, there is venous stroke, there are so many other strokes. But two major strokes which we will encounter in day-to-day life is either ischemic stroke or hemorrhagic stroke. Both have similar factors. both high BP, high blood glucose, so diabetes, high cholesterol can have both type of strokes. So coming to ischemic stroke, the brain function impairment can be due to blockage in one of the blood vessels that takes blood to the brain. So starting itself at all from heart through neck to the brain, we have major blood vessels. So the one which will have from the anterior is called internal carotid arteries. So that is for brain, major brain. The other major vessel is vertebral artery. Vertebral artery is for small brain. So our cerebellum, pons, midbrain, medulla, those are called brainstem structures. So these brainstem structures are very important for balance. So that is the vertebral artery. If any of these vessels gets blocked because of cholesterol or high blood pressure or increased blood glucose, then impairment of that particular brain area will be there, and because of that the symptoms arises. So when the blood circulation comes down, it is called as ischemic stroke. So this also involves when the blood vessel gets burst, then the bleed occurs into the brain, and that is called hemorrhagic stroke. So how do we identify a stroke? So first symptom which we have to know is sudden loss of consciousness. This means patient who is talking, they become unconscious. They don't respond to what we are asking, or they don't get up. So this generally we see that night patient sleeps well, morning when we ask to wake up, patient is not waking up in the regular time. Then we see that patient snoring ఎక్కువైపోవడము, కాలు చేయ ఆడకపోవడము. So those symptoms, sudden loss of consciousness is one of the stroke symptoms. Second is numbness, తిమ్మిర్లు పట్టడం, లేక మొద్దుబారిపోవడం, complete one half of the body, face, arm, leg, body, complete if it is there, then also it can be a symptom of a stroke. Next, dizziness, loss of balance, coordination. So unable to walk properly, unable to walk in narrow places, suddenly spinning of the surroundings. That is very important symptom of a stroke. Then confusion, trouble understanding. So after that, clear the monitor. But suddenly, when they ask, "What is your name?" they may not be able to tell. What is that you are holding? They may not be able to tell. So sudden confusion. Then headache with no known cause. Those all can be symptoms of stroke. And in this, there is a caveat. All these symptoms can also be present normally. So we need to identify when is the stroke. So the symptoms like long standing, అంటే పొద్దున్న లేస్తే తల తిరగడం ఇలాంటివన్నీ చాలా మందికి ఉండొచ్చు. సో నో సిమ్టమ్ టిల్ నౌ, అండ్ దిస్ ఈజ్ యువర్ ఫస్ట్ సిమ్టమ్. ఇప్పుడే ఫస్ట్ టైం నాకు జీవితంలో కళ తిరిగినట్టు, జీవితంలో ఇలాంటి కళ ఎప్పుడూ చూడలేదు. మొత్తం చెయ్య కాలు మాట అంతా ఒకేసారి మొదలుపారినట్టు అయిపోయింది. సడన్ ఆన్సెట్. సో ఇట్ షుడ్ బి suddenly. It is not like slowly developing. It should be a sudden onset, and it should be a first time. So then we should be considered immediately, and you should consult a doctor. And even in vision, if you have sudden vision loss, either of the eyes or one of the eye, then also it could be a symptom of stroke.
It may continue, no sir? It will come and again.
It will come. Sometimes it may go. It may improve. That is called, I have mentioned even that, transient ischemic attacks. So, and these are repeating multiple times. Then also you should be cautious.
If it is once, then you are not much worried.
If it is severe for the first time, you should worry.
Okay.
But it's a very transient, only one time, sometimes okay. But get blood pressure checked up, blood glucose checked up, and see if they are normal, then you not. And this is also they told that it is a universal phenomenon, but there are some exceptions also. When the right side of the brain is damaged, generally the effect will be seen on the left side. It will be on the opposite side. Except like cerebellum, I told you before, small brain, it will be on the same side. In general, majority of the major brain effect, right or left, if it is on the right, then the effect we see clinically will be on the left side. So what are the common causes of this stroke? So most strokes happens when a blood clot blocks the flow of the blood to the brain, and it forms and these vessels get deposited by the fat. So because of that, circulation comes down. So most common cause of any stroke is high blood pressure. So diabetes, high blood pressure, high cholesterol are the initiation or the triggerance for a development of a stroke. Lifestyle is the next important factor. Poor diet, excessive alcohol, drugs, smoking increases the chances of stroke. So lack of exercise is also one of the important stroke risk factor, lifestyle stroke risk factor. So poor diet, excessive high blood pressure, high cholesterol, family history. So if a family has diabetes, hypertension and a stroke, then you need to be cautious. You not worry, but you need to be cautious and modify your lifestyle according to that. Age more than 55 or above is a general criteria, but we need to be worried after 30 years of age because of the environmental conditions now we have. And men are at a risk of high risk of stroke than women. Heart diseases like heart failure, heart defects, heart infections can also cause brain stroke. So what are these complications? As I told, they can be temporary or permanent disabilities. They can have paralysis or loss of movement on one side of the body, such as one arm, one leg, or speech. Difficulty talking or swallowing. Memory loss or thinking difficulties. Emotional problems. So how do we prevent this stroke? Management of the risk factors. So first risk factors like high blood pressure, blood glucose, cholesterol, all that you need to keep under control. Then avoid smoking and alcohol. Then walking. Include exercise in the activities. A brisk walk, swimming or any other exercise activity as less as 10-30 minutes is definitely helping you in preventing a stroke or delaying a stroke. So how do we diagnose as a doctor? Just you need to complete the stroke. No? So I will tell about the neurological examination. Neurological examination, we see how is the mouth dilated, unable to close the eyes or open the eyes, movement of the eyeball, gripping of the hand, and able to raise the leg above the bed or not. So we check all these and see that whether the patient is having a stroke or not. So what are the laboratory tests required? So CT scan is the basic investigation we see because CT is less time and it will be less cost and it will be done immediately. So within 2 minutes we can get a CT report, and in CT we can find that whether there is a brain hemorrhage or a brain clot. Clot may not be seen within 1 to 2 hours, but hemorrhage can be seen within half an hour. If the patient reaches to the hospital within half an hour, if there is a hemorrhage, CT can easily find it. But a clot cannot be easily found on a CT. There, if you want to confirm it, we need to do an MRI. So management. As brain cells begin to die within minutes of a stroke, the treatment should be rapid. So this is important because each neuron is very important. We have more than 5 million neurons in our brain, actively working continuously even when we are asleep. నిద్రపోతున్నప్పుడు కూడా ప్రతి న్యూరాన్ పనిచేస్తుంది. So when this oxygen comes down, within 8 minutes, brain can completely get damaged. And like in an experiment, if we completely stop oxygen to the brain, within 8 minutes, it is going to completely get damaged. So, stroke వచ్చేది only one side or two sides, any side can happen. So within 4.5 hours, if you don't act, then it may cause a permanent deficit for the patient. So medicines that prevent the agitation of clots or break the clots, which we call as blood thinners, has to be used. And sometimes in a hemorrhage, we need to remove the clot. Aspirin is the first aid of treatment given in case of emergency to reduce or prevent further strokes. So these are the points to be remember. This is fast First is F stand, it's an acronym where we need to identify the stroke. F stands for face, like numbness in the face, deviation in the face. When you see, it is the first symptom you need to notice. And next is A, arms. You need to check whether there is any weakness in the arms. Speech, whether there is any snarling of the speech, if it is present or not. And time. So as I told, within 4.5 hours, we need to immediately reach to a hospital. So here if you can see, there is a, here you can see the nasal fold, but here you cannot see a nasal fold. So this is a smile being differentiated. So this is one. R, when it just holds down, it cannot be raised. Speech, when unable to speak. So this is actually a US slide, so they call 999 or 101. Here we can call 108. So I thought that few of the slides which already you might have a doubt, I have put them as myths or facts. After this we can have an open discussion about your doubts. Myth is that stroke cannot be prevented. May not be 100% prevented, but we can prevent a major stroke. Up to 80% strokes are preventable. 100% I also say it cannot be prevented. How strict you are, like how yoga chasing sadhu jitam chesna kuda, sometimes you can have a stroke. So these are a completely different topic. But 80% of the strokes can be prevented. Stroke affects only the elderly. అంటే 65 75 వాళ్ళకి స్ట్రోక్ వస్తాయంటే my youngest stroke is a 10-year-old child. So the cause is different. But regular e-risk factors, what I have told for an elderly stroke, I have seen in a 21-year-old patient. So my youngest patient is 21 years with those risk factors. So it can affect any age group. Stroke can happen to anyone at any time. Stroke happens in the heart. Heart attack another telusu, but brain attack is also there. It is also important. Stroke is a brain attack. Stroke recovery happens only for the first few months of a stroke. This is partially correct. First few months of the stroke, recovery is very fast, but it is a continuous process. So lifelong he has to have treatment in form of rehabilitation and also therapy. So stroke recovery is a lifelong process. Strokes are not hereditary. Strokes in an old age stroke may not be hereditary, but few strokes can be hereditary. Family history of a stroke increases the chance for the next kin or kith to have a stroke if they also have the risk factors. If stroke symptoms go away, you don't have to see a doctor. No, sir, madam has asked no. So temporary stroke symptoms are called transient ischemic attacks. So they are warning signs prior to the actual stroke and need to be taken seriously. So when to take those seriously is that all these symptoms are a sudden onset and at the same time you have a high blood pressure at the same time. You need to evaluate yourself to prevent a major stroke later. Stroke hits without warning. No, as I already told, transient ischemic attacks or TIAs can happen prior to the stroke. They disappear within minutes or hours, but should be seen as a clear warning that more severe stroke might follow. Early medical attention and treatment will prevent this. These are called as mini strokes. Stroke attack is instantly paralyzing. Sometimes it can be instantly paralyzing. Sometimes it may only one side of the body can be seen drooping. It may cause some less noticeable symptoms like numbness and tingling. Some strokes called silent strokes will not have any symptoms. It can be seen only, it can be seen slowly or rapidly. Sometimes only imaging will help us that patient had a stroke. Only certain ethnic groups have a greater risk of stroke. It is true, there are certain ethnic groups which can have more stroke at an earlier age group. Like South Asians, Hispanics, African Americans, they are more prone to stroke than the Caucasians. These are some myths I thought would be helpful. Any further doubts, I am open to discussion.
As soon as you said stroke, like one of us thought that it is about Stroke means nowadays synonymous with heart stroke.
Heart stroke.
So statically we could understand that it is about
Brain stroke. So we don't use that word as brain attack. We commonly use it as heart attack, but we don't use it as brain attack because it is much more frightening. So we call it as stroke.
Excuse me, sir.
And
Is trauma is a curable disorder, sir?
which one, sir?
Trauma.
Trauma. Head trauma.
Head trauma.
Head trauma, it depends. It can be trivial to major. So what type of trauma you had? I mean, the patient.
PTSD.
Post-traumatic stress disorder. We are talking about a completely separate topic. See, post-traumatic stress disorder may not be only because of a head trauma. So anyone close to you, like some grandmother or grandfather or mother or someone who you like most is suddenly lost, then you can have PTSD. Head trauma because you are very much cautious, but you still had an accident. Then second time you are worried about going on a bike. So that is PTSD, post-traumatic stress disorder.
Is it curable? Can it be cured?
Only treatment can't cure. Patient also should accept, and he requires a good counseling.
Accept what? Accept what?
Which one? The trauma which has happened. Then only it can be cured. If there is treatment, cure you are asking is permanent cure.
Yes, exactly.
Yes, permanent cure cannot be there if the patient doesn't accept it.
So nerves are damaged now, it cannot be repaired.
No, post-traumatic stress disorder is not always with nerves. It's all about the thinking capacity, hormones.
Feeling. No,
So-
people usually say if you think negatively, so that will be their impact on the
Brain.
brain and all. Is
Yeah.
it so?
Yeah, definitely.
Acha.
So it is indirectly increasing your stress. All stress will increase your cholesterol, bad cholesterol levels in your body. So definitely it will have an impact.
Okay. So, can you explain some of the things these are? For example, BP under control, sugar should be like that for not to have stroke, such
They are called as modifiable, non-modifiable factors like obesity,
obesity. Okay.
yeah, sedentary lifestyle, sitting for prolonged hours, especially our professionals. Then third, lack of exercise in any form, either yoga, meditation, cycling or walking, anything if it is not there, then that is a risk factor. Then fourth, high blood pressure, high cholesterol, high blood sugar levels, smoking, alcohol. These are all the risk factors which can cause a stroke. And these risk factors are common for heart and brain. They can have both.
Usually people say those who have a sugar better they should take this ecospirin,
Blood thinner.
Blood thinner. Is it
Gui-
advisable?
Guidelines, what it says is, when you have diabetes for more than 5 years, then it is good because it has 5 target organs: diabetes, retina, eye, then brain, heart, kidneys. So all these, they have an end vasculatures we call, because the blood vessels, what we call is artery, vein, capillaries. So end capillaries are there, so they don't have further circulation, so they get damaged. So when you have a patient with diabetes more than 5 years who are still under strict control, it is better to use a single antiplatelet, which is ecospirin, which is a cheaper thing to prevent damage of these end organs.
Any specific time is there at any time?
Ecospirin.
Ecospirin
Ecospirin generally we ask to take after lunch.
after lunch.
If you are also using an anti-cholesterol agent, anti-diabetic drug in a combination, then we ask to take it in the night. Because anti-diabetic drugs, they have cramps. So we ask them to take it in the night.
suppose if you find a person, maybe somebody, you find them suddenly unconscious, is there any precaution or some kind of first aid that we can do, or only way is to bring to the
No,
doctor?
see, anywhere, if, like in this plant, if you have someone who has just found to be collapsed, so we immediately bring him to the first aid center there, which is nearby to you in your hospital. First thing which we need to check is his blood pressure, his blood glucose. So the most common cause of unconscious is hypoglycemia. So you have duties in shifts. So somewhere they may come at around 6 o'clock. They may not have their breakfast. Around 7 to 8 o'clock, because of the low sugars, because even if they don't eat in the night, they will just fell unconscious. So the first thing you need to see is the blood sugar level, see the blood pressure level. If there is hypotension and hypoglycemia, that means low blood sugars, first correct that. If after correction of that, if they are normal, you need not worry. So the first step which we have to do is check the blood glucose level and the blood pressure level. So if they are not improving, then you need to refer to.
What I'm asking is like being shifted, first aid center is also a hospital. CPR laga something like what the mom individual what are suggestive immediate attention that we can give to the other person?
Sudden unconscious avadanic reasons seizure avachchu, syncope avachchu, stroke avachchu, heart avachchu, brain avachchu, or anything can happen. Of these may be the major events. What I am telling you, these are the major events. So first aid, what if it is a seizure, you can see that they are having involuntary movements. గాజు చేతులు కొట్టుకోవడం, నాలుగు ఖర్చుకోవడం ఉంటుంది, ఫిట్స్ అన్న. సో ఫస్ట్ థింగ్ దానికి ఎక్కడ ఓపెన్ ప్లేస్ ఉందో అన్ని మీద పడుకోబెట్టేసి ఫస్ట్ థింగ్. యూ షుడ్ నాట్ మేక్ హిమ్ సిక్, యూ షుడ్ నాట్ గివ్ హిమ్ వాటర్, నథింగ్ షుడ్ బి గివెన్. ఫస్ట్ మేక్ హిమ్ లై డౌన్, లై డౌన్ అండ్ టు ఏ సైడ్ లాటరల్ పొజిషన్. తల ఎప్పుడు నేల మీద ఉండాలి, తల ఇలా వెనక్కి ఉండకూడదు. ఓకే, తల ఇలా వెనక్కి ఉంటే యువర్ టంగ్ గోస్ అండ్ ఫాల్స్ బ్యాక్వర్డ్ అండ్ స్నోరింగ్ ఇంక్రీజెస్ అండ్ ఇక్కడ ఉన్న సలైవా ఇవన్నీ లంగ్స్లో వెళ్ళిపోతాయి. దట్ ఈస్ కాల్డ్ యాస్పిరేషన్. సో సడన్గా choking అయిపోతుంది. So first thing we need to make them lie down on the floor. No problem, nothing will happen. On the floor, lie down, side position. So side, ఇది ఫిట్స్ లాగా కనిపిస్తుంది. బట్ జస్ట్ పడుకోయారు అంటే మాత్రం
చేతుల్లో కీస్ అని పెట్టారు, అది
పెట్టినా పెట్టాలన్నా పర్వాలేదు.
బట్ ఓకే, అది అసలు ఇట్ ఇస్ నాట్
నథింగ్ ఏం మ్యాటర్. వాట్ యూ కెన్ డూ ఇస్ మెయిన్ ఇస్ ది బైట్ దేర్ టంగ్. సో సమ్ నాన్ మెటాలిక్ లైక్ వుడ్ కానీ పెన్సిల్స్ కానీ యూ పుట్ బిట్వీన్ ద టీత్ సో దట్ హీ డజంట్ బైట్ హిస్ టంగ్. నాట్ ఈవెన్ మళ్ళీ ఐరన్ ఏమి పెట్టకూడదు, దొరికేది అది అసలు పెట్టకూడదు, పెడితే పళ్ళు ఉడుకుతాయి. సో నాన్ మెటాలిక్ ఐటమ్ షుడ్ బి కెప్ట్ ఇన్ ద మౌత్. ఇఫ్ కొరికేస్తున్నా బికాస్ ఇఫ్ యూ పుట్ యువర్ ఫింగర్ యూ బైట్ అండ్ యూ విల్ ఫ్లడ్ అవుట్. సో యూ పుట్ ఏ నాన్ మెటాలిక్ ఐటమ్. Better is pencils. You will have pencil everywhere. That is a wood. Put it in the teeth so that he will not harm himself. He will not harm others. And it has to be, head should be lying down and body should be in the side lateral position. So put BP down and put a. So for that you need to raise his legs up. So when you raise your legs up, circulation to the heart increases. So immediately BP rises. BP rises, conscious of that. So that is one more first aid which we can do. అది ఫిక్స్. ఇది జస్ట్ కళ్ళు తిరిగి పడిపోయి లో బీపీ లాగా ఉంటే కాలు పైకి ఎత్తాలి,
పడుకోబెట్టి కాళ్ళు ఒకటి ఇలా పట్టుకోవాలి.
సో వాసోవాగల్ సింకోప్ అంటారు. కొంతమంది బ్లడ్ చూస్తే కళ్ళు తిరిగి పడిపోతారు, రైట్? సో అవి సడన్గా బీపీ డౌన్ అవ్వడం. అలాంటప్పుడు చేయాల్సింది ఏంటంటే పడుకోబెట్టేసి ఫ్లాట్గా బెడ్ మీద అయినా పర్వాలేదు, లెగ్స్ పైకి ఎత్తాలి. కాలు పైకి ఎత్తితే యూ విల్ హ్యావ్ సర్క్యులేషన్ ఇమీడియట్లీ ఇంప్రూవ్. స్నోరింగ్, ఒబేసిటీ, వెయిట్ బార్.
మామూలుగా జనరల్ గా పడుకున్నప్పుడు స్నోరింగ్ చేస్తారు. దట్ ఈస్ వాట్ వి ఆర్ ఆస్కింగ్.
నో నో, ఎక్సెసివ్ స్నోరింగ్.
అంటే నిద్రపోతున్నప్పుడు స్నోరింగ్ చేస్తారు కదా.
నిద్రపోతున్నప్పుడు స్నోరింగ్ ఏంటంటే యూ స్లీప్ ఫ్లాట్. ఫ్లాట్గా పడుకున్నప్పుడే స్నోరింగ్ ఎక్కువ వస్తుంది బికాస్ టంగ్ ఫాల్స్ బ్యాక్. టంగ్ ఫాల్స్ బ్యాక్ కాబట్టి ఇట్ విల్ డిస్టర్బ్ ద నార్మల్ ఎయిర్వే ప్యాటర్న్. నోస్ నుంచి లంగ్స్లోకి వెళ్ళేది మధ్యలో యువర్ లైక్ టంగ్ విల్ అబ్స్ట్రక్ట్ దట్. సో దట్స్ విల్ కాజ్ స్నోరింగ్. సౌండ్ విల్ కమ్ బికాజ్ ఆఫ్ దట్. అలాగే సైడ్ పడుకుంటే తగ్గుతుంది. అంతే కదా మీ వైఫ్ అలా పక్కన తగ్గుతుంది. దట్ ఈస్ మెకానిజం అన్నమాట యాక్చువల్లీ. సో వెన్ యూ సైడ్ టర్న్ సైడ్ టంగ్ పక్కకు జరుగుతుంది అన్నమాట, ఎయిర్వేకి పక్కకు వెళ్తుంది. సో స్నోర్ తగ్గిపోతుంది, సౌండ్ తగ్గిపోతుంది.
Sir, excuse me.
It's okay.
Nowadays, the youth are also prone to anxiety and disorder. I have seen a young lady who is studying BTech first year, has entered into the doctor's room and she was perturbed regarding how many ways a human being can die. So doctor was teaching her that there are 4 lakh or something like that. In the ways human being can face the end. So still she has been continuing, and the doctor, out of kind concern towards the patient, has referred her to the psychiatrist. The psychiatrist has given her Paradise 1.5, clonazepam, and what do you call escitalopram, and all these things. Now she has up to 40 years of age, and still she has been continuing using all these medicines. Now does it any does the things related to any brain stroke? If she all of a sudden, if she hears some question of what do you call shocking news and all these things, because psychiatric problems have been nowadays increasing for even younger generation. That's what I have seen apparently.
Yeah.
Can you throw any light on that one?
See, stress is an important part,
Yeah.
whether it is psychiatric issues or a working issues. So we need to enjoy our work. So that without that, anywhere you can't get success. So medications causing stroke can cause stroke. Out of all the 4 medications which you have told, they are less prone to getting a brain stroke or a heart stroke. Okay? So those 4 medications, side effects are dependency. If you try to stop them, they may again have those anxiety symptoms. One problem is that. Okay?
Does this things to be lifelong continued, or they can be?
No, see, psychiatric drugs are always from the patient. If patient by age, by experience, if they are molding their lifestyle, then they don't require those medications. But if you accept your illness, నాకు తగ్గదు ఇది వేసుకోకపోతే నేను ఉండలేను అని అన్నప్పుడు యూ హ్యావ్ టు యూజ్ ఇట్ ఫర్ లైఫ్.
As such, there is no threat that suddenly he may collapse and all these things it could happen.
I am thinking I don't have any stress, for example. So how do I know whether really I am stressful or not? No. Yes, sir. People are telling na, office stuff, stress, this, that. But as such, we don't feel. I don't know why many job holders are feeling it is stressful. So I am getting doubt whether I have a stress and.
If you ask a question, they don't answer.
Ah.
For that you need
No,
to
that
give. There are so many questionnaires. So you supply those questionnaires to your staff. So in an individual way, they will answer and they will come out what stress they are feeling.
No, now there is office stress they are telling. They are getting 1 lakh, 2 lakh, definitely that much input they will take, no output. So they need to do more work in the less time. That's all. If they don't want that much, they can go for the other jobs and they will get less salary and all these things. That they should not consider it as stress. That is a job because he is giving salary. So that much job we are doing it, I feel. This is my analysis I am telling. So I am getting doubt why every second person is telling nowadays younger generation we have a stress. Especially with the otherwise Saturday is a holiday, Sunday is a holiday. So they go for the outing, they go for the enjoyment, everything is going on. But still they are telling that they are stressed.
Mobiles is one more reason in this generation. Fast life is one more reason. So you want everything fast. So like if I say, I will quote my own example. To become a neurologist, it took me 16 years. So my son, when I asked, because my father is a doctor, I am a doctor, generally when we go to friend's house or relatives' house, they ask, next doctor you will do that. So he immediately tells, I don't want to become a doctor. Right. Because he has seen me, like when I was doing my neurology residency, 17, and when he was born, he was 8 months, and first 3 years of his life, I was doing duties in my hospital. There were days, 3 to 4 days, he has never seen me.
Okay.
He doesn't understand now that, but he feels that I can't work that much.
Right, but during
He
3
is
years,
prepared, he is not just
like 3
8
years, he cannot remember. certainly he cannot remember 3 years what has happened.
No,
When
he
he was-
remembers, he asks, he tells me, you never came to home.
No, that somebody must be telling, your wife or somebody. Definitely
After
they
1
can't
year, he
remember.
knows that.
Before 3 years, what has happened, children cannot remember, I can guarantee.
No,
Only
this
people
generation
will
is
say,
completely different.
like behind the videos and chatting, so he used to work and all these things must be going on, they must be thinking. So even if it doesn't come, how does it matter after?
It is important.
No, it is important, we are taking care, na? So next day you will be visible to them, now they are going to Australia. How many years we are not seeing your child? You tell me.
No, that you go that
Like
is completely
America,
different.
children are going to America.
That is completely different.
No, they are not coming now, we are also not seeing.
So
Now
that is
they
a
think
different
that
type
is
of stress.
important.
That is different type of stress. See,
Yeah,
there are so
important.
many of families who come to me as patients. They call me as their son because their son is not there in India, and he comes only yearly once, or may not be even not possible for that. So any health issue, they can talk 24 hours on a video call. If he is so happy they are talking, but that is not a satisfaction. They want someone in person talking to them.
If they don't go one stress, if they go another stress.
Another stress. So content of life is more important. So even in the same way, in the office also, the stress is that the content is more important. Enjoying the work, what I told before also. You need to enjoy your work, otherwise you can't.
This laughing therapy people say, it will be helpful.
Definitely.
Not that purposely you laugh, but you play some jokes and
That way it is better.
That will
Not going to park and just laugh. Like
Yeah,
that,
just
that will not help.
help.
But in a group of people talking good things, enjoying that definitely helps. Your stress comes down, your blood pressure comes down.
Sir,
Simple.
blindness and paralysis is caused by this brain stroke. How to best treatment for that? And is it curable or not?
Stroke, brain stroke,
Blindness and paralysis.
blindness and paralysis. So patient is blind and
Blindness, partially blind, clearly not visible.
Okay.
With my father-in-law only.
Hmm.
And it is what is the treatment, full treatment, and paralyzed in left side. Both limbs are not working. What is the treatment?
Treatment is nothing different, sir. It is the same. You need to cope up with some psychiatric issues also because he is blind, I mean partially visible, and now he is requiring support to walk. So he requires a moral support and a physical support more. Treatment wise there is nothing different. Treatment is the same whether he is blind or not blind. And the stroke, if it is ischemic stroke, that is one type of treatment. If it is hemorrhagic stroke, the treatment is different. That's all. But the treatment will not change whether he is blind or not blind.
It's only physiotherapy treatment or some medication?
Medical, I don't know. Ischemic stroke, you will have certain group of medical, like blood thinners have to be used. And if he is hypertensive, antihypertensive have to be used. If diabetes, anti-diabetic medication.
Diabetes, BP.
So those two medications have to use. If it is hemorrhagic stroke, only the BP medications he has to use. And we call some cognitive enhancers. Those therapy will be there. That can be given until 2 to 3 years. After that, it will be like a placebo. If he gives some, if he is happy, you can give that. If he is not so happy with that drug, you can stop that. But BP medications and all should not be stopped. Those should be continuously used.
This hand and leg is not working.
That physiotherapy, physical
How
therapy.
many times you take for recover?
It depends on how much physiotherapy he is doing and what is the size of the clot. How much of physiotherapy he has done for the first 3 months of his stroke. So based on those factors, his improvement will depend. Like if you have a fracture of a hand, surgery is done, both the bones have been fused, but the movement of the hand will depend on the physiotherapy you do. So exercise if you don't do, the muscles gets paralyzed again.
Actually, within 1 month he is recovering.
Within 1 month?
1 month he will start walking.
Okay.
Means with support.
Okay.
Somebody is deciding then he is walking. That's
So
all.
with stick and all, you can walk now, maybe.
Yeah.
So you are asking for a complete recovery. When we have complete recovery, that we need to see the patient to tell whether he has a complete
65